My name is Dr. Mercy Mwangangi, and I'm the Chief Executive Officer of the Social Health Authority. And I'm pleased to be able to engage with you today to share with you the impact that the Social Health Authority has had on Kenya and the citizens. And perhaps where we start is by looking at what was there before, trying to understand what was there before, and then why we're doing what we're doing right now, and why we have reforms that have led to the creation and implementation of the Social Health Authority. Now, any country in the world has to make an investment towards the health of its people. And that's because a lot of evidence has shown us that when you invest in health and health systems, then you also invest in the economic development of a country. So people summarize it by saying health is wealth, and that is very true. Now, Kenya has been on a journey towards universal health coverage all the way since independence. UHC means that all Kenyans, the U is the universal part, all of us Kenyans are, one, covered and have health that is able to ensure that we have good services and good health outcomes. Now, if you look at what we are doing right now with the Social Health Authority, which is a constituent of 3 funds, Kenya right now, if we were to look at the Primary Healthcare Fund, we would say that we are at 67% population coverage. A second key component that I touched on before I mimic, what is closest to NHIF, which is the Social Health Insurance Fund, would be the ECCI fund, where again, for the first time in this country's history, an administration has decided to focus on emergency services. This has never happened before. So the Social Health Authority has then the middle fund, right? We've talked about the Primary Healthcare Fund and we've talked about the ECCI fund. Now, the middle fund, the Social Health Insurance Fund, is a contributory fund. And this is the fund where you and I, as Kenyans, contribute into it, and then we're able to get benefits, particularly secondary care benefits. Now, this fund perhaps is what would mimic to the previous NHIF. And so even just by barely looking at the design of the current reform and what was underway in the previous administration, you can see that this government has been deliberate about primary health care, has been deliberate about emergency care. Now, in the middle fund, the Social Health Insurance Fund, in the lifetime of NHIF, the highest collections that NHIF ever received from the national scheme. If you remember the old national scheme, this is what Kenyans would pay into, which was about 500 Kenya shillings. The highest collections that were ever done then, just for the national scheme, was about 40 to 45 billion. Now, NHIF also ran other schemes, many other enhanced schemes. There were about 88 other enhanced schemes. And so if you look at the financial statements of NHIF, you'll notice that perhaps towards the end of NHIF, their collections were around 80 billion, 70-something billion, thereabouts. SHA, in 17 months, has been able to have collections of 203 billion. Just let that sink. From 88 billion to 203 billion. And I always like to emphasize to Kenyans, this is not old money. This is new money that has been invested in our healthcare services. And so by any measure, this is a positive move in the right direction. All the packages that were there prior to NHIF, SHA has improved and marked them up almost by 12 to 20%, depending on the different packages of care. And additionally, we have introduced primary health care, we've introduced emergency care. I always say, without fear of contradiction, this investment is good for Kenyans. This program is good for Kenyans. Do we have teething issues? Yes, like any new program. As you know, right now we are fully implementing a fully digital system. It means our digital infrastructure needs to be mature enough to do the same. And we are working towards that. We've seen gains. I always tell people, particularly partners who come and engage with the authority, we don't do any manual processing. NHIF, if you went to the former NHIF branches, and I have all those documents, you'd see folios of paper. A claim was this big. And a claims officer in NHIF had to go through the manual file. My claims officers do not do anything manually. There is no paper. Everything is within a digital system. And again, that's an improvement. So for me, we have demonstrated impact in just 19, 20 months and shall continue to harness more impact There are things that we want to improve upon as we continue doing this. We want to look at ICU care further. We want to look at newborn care further. We want to perhaps even extend the packages for newborn cares. We know preterms will be in the neonatal unit for sometimes up to a month. Right now we do reimbursements of 12 days. So we want to see how we extend that further. But at the end of the day, the construct of this reform is robust, and it is supportive of ensuring that Kenyans have better health outcomes.